Hi, my name is Ms. Nikki Wallace, and I'm coming to talk to you today about an issue that's really important to America right now. And um, before I begin to talk about that, I really feel like we really need to understand some of our past so that we can understand how our future is going to go and how biology plays an important role into that future. So I'm going to begin by doing this Zoom broadcast, and I will share my screen in a moment so that we can go through a PowerPoint. And in this PowerPoint, I'm going to ask you to play a role. So first of all, I'm going to play the role of the storyteller, the note taker, and someone who's desperately trying to figure out how to deal with this medical issue that's come about in our healthcare. And you will eventually play the role where you're choosing to be a health professional, either in Hong Kong, China, Toronto, Canada, Geneva, Switzerland, as a member of the World Health Organization, the Center for Disease Control in Atlanta, Georgia, also. So let's get started. I'm going to go ahead and share my screen right now. So as I mentioned earlier, there's this idea of Sankofa. And in Sankofa, it's actually a symbol using Ghana that depicts a bird with its head turned backwards, taking an egg from its back. And what it really expresses is the importance of knowing what our history is, the knowledge from the past, and bringing it to our present so that we can make positive progress and positive movement towards our future. And I really do feel when we're looking at disease and disease surveillance and how viruses are transmitted in human populations, that it's really important for us to take a glimpse of what happened in the past. Okay, so let's go forward. So like I said earlier, you guys are going to choose who you want to be. And I would welcome you guys to start a Google spreadsheet, a Google sheet, a Google document to take notes. And I'm going to ask you 4 questions as we go through this story. And I'd like for you guys to determine who you would like to, what role you would like to play in this scenario. So first off, in Foshan, Guangdong, China, there is this area central to this Pearl River Delta region where there's like a lot of fertile land, has mild, wet, subtropical monsoon climates, and pretty much has 4 distinct seasons similar to our weather, and an average temperature of about 80 degrees Fahrenheit. So back in November 16th of 2002, a case came about, and this was a case that was sent to the intensive care unit in Foshan City in Guangdong province in Foshan, China. And basically the person presented themselves with this high fever, a dry cough, a rapid progression to respiratory failure, and a radiographic evidence for bilateral lung damage. And all that is saying is that they took an x-ray of both sides of the lungs, and there was damage present in both sides of the lungs. And what had happened with this particular case, 4 family members had direct contact with the patient, and it was spread to those 4 members, and the patient was treated without significant improvement, and they had a history, as they found out, that they had a history with wildcats and were eating their meat. So that was that scenario. And then there was another case in December of that same year in 2002 where there was a chef in the city of Haiyang. It's about like 200 kilometers from Foshan in China, and this person worked at a restaurant in Beijing, and they had something that was not like a normal, atypical, an abnormal, which is atypical, not normal. A meaning not typical, pneumonia, and the person was a male. He felt unwell in Shishing, and he sought medical treatment in Haiyang. Sorry. So what happened is this person had a mild fever, respiratory symptoms. His x-ray or radiograph showed that he also had infection in both of his lungs. and his wife, 2 sisters, and 7 medical staff as a result were infected, and all of them had the same symptoms and problems as a result of that. And this patient, who was a chef, he came into regular contact with several types of caged animals that were using exotic game food. So what they started to notice that between that time in November 16, 2002 and to February 2003, that there were this outbreak of cases starting to occur. And so they started to figure out like how many people there were in these affected cities. So they noticed they were just starting to spread. It looked like the epicenter of it started within Guangdong, but it just started to spread across this region in Foshan. So in February 11th of 2003, the World Health Organization, they received a report from the Chinese Ministry of Health of an outbreak of an acute respiratory syndrome with 305 cases where 5 people died in Guangdong province. And 30% of the cases reported occurred in healthcare workers. And so signs and symptoms were this unnormal, unusual case of pneumonia, atypical. So my first question is, you make a phone call to the officer or health in Guangdong province, but there's only poor communication only allows you to ask 1 or 2 questions. So as you notice, it was difficult to pronounce some of those cities for me because they were in China. But so just imagine if you wanted to really ask some deep questions to these individuals and you are coming from the outside in. So what would you like to know from them? Would you like to know if they are, if you are a health professional working in Hong Kong, China, if you're a health professional working in Toronto, Canada, if you are a World Health Organization officer in Geneva, Switzerland, or if you are Centers for Disease Control officer in Atlanta, Georgia? What would you, if you were one of those, what 2 questions would you want to know of those officers that are in Guangdong province? All right, so let's move on. So a little bit of time has passed, and on February 21st of 2003, a 65-year-old medical doctor in Guangdong province, he treated patients in his own town. He checked into the 4th floor of a 4-star hotel in Hong Kong, and he treated patients with that same type of pneumonia prior to his departure from Guangdong province and was symptomatic upon arrival in Hong Kong. And there were other cases that resulted of that. So there was a 48-year-old Chinese American businessman who was admitted in the local hospital in Hanoi, Vietnam. And there was a 3-day history of respiratory symptoms. And he had previously been in Hong Kong, where he had visited an acquaintance staying on the 9th floor of the hotel, where that same physician was. And then in March, another person, a 26-year-old flight attendant, was admitted to hospital in Singapore with the same symptoms from that same area. And then in March 5th, 2003, an elderly Toronto woman who had been a guest on the 4th floor of that Hong Kong hotel, she actually dies at a Toronto Scarborough Grace Hospital. So 5 minutes of her family were infected and admitted into the hospital. So highly, highly contagious. So the World Health Organization finally figured out terms for this new disease, and they called it severe acute respiratory syndrome, or SARS. It declares it a worldwide health threat. So not much information, but they named it severe acute respiratory syndrome because they noticed that same respiratory problem in all the patients. So as time progressed even further, the number of cases became steadily increased. It ended up being, by the time of April coming around, there was 2,671 cases. So you can see at this map, all of the different regions, the countries that had cases. It had spread from China to Hong Kong, to Vietnam, to Singapore, to Canada, to the United States, so even reached Brazil where there was 1 case. So we can see how transmission occurred either through no local transmission, and then some of these cases it started to become a local transmission. So now I have another question for you. Now that you have more information, what would you do? So pick 1 to 2 most important actions you would consider. And while you're thinking about that, consider you've already chosen what role you are. So think about it in the terms of that particular healthcare professional. What would you ask? All right, now that you've had some time to think about it, let's give you some more information. So what they've noticed now is that the mortality rate of the SARS fluctuated across the countries and also in reporting organizations. And in early May of 2003, the World Health Organization and the U.S. Centers for Disease Control quoted SARS mortality at 7%. Others spoke in favor of a 15% figure, saying it reflects the real situation more accurately. So as the outbreak progressed, more mortality measures approached 10%. So there generally was no real consensus about how the mortality rate would occur or was occurring with this particular disease. So as a result of that, the World Health Laboratory, they announced conclusive identification of this SARS agent, and they found out it was the coronavirus. And it was like any other human virus, just drawing some similarities to today from what we just looked at from the past. You can see that this coronavirus is it's a similar virus as what we're hearing today about the COVID-19. So people make these common misconceptions that when we're talking about the coronavirus, they're talking about the corona beer, but of course not. That's not the case. But there's this particular disease that can be caused by this particular virus that they find it normally in animal members, but it has actually crossed over to humans. So basically, the cases of the SARS between the January 1st to April 2003, you'll notice that it started to peak. It started, early January. A lot of cases in February, between January and February, and then it peaked again between March and April. So this disease started to spread and affected a lot of individuals. And I kind of definitely see echoes of this today, and that's why it's just so important to understand where we come from in our past. So at this point, they already experienced this, so they had to figure out, now what are we going to do now? It's 2003, it was 1998 when this happened. Over 10 years, almost, well, a little bit less than 10 years between the two. What are we going to do now? Can we take another hit? So now let's reflect a moment. Does this information change the actions you decided for question 2? My next question is, the Chinese government, now, they invited you to attend the first annual SARS conference in Foshan City and the second anniversary of the first case. Would you attend? Why or why not? All right, so now that you've had a chance to really think about this, and you have had the opportunity to write down your thoughts and reflections about this scenario, what could you do to help alleviate and change the trajectory of this disease? And how can you use the past to understand that current situation? So what we're going to do now is we will start on a discussion board where you will write down your ideas on how to tackle this disease. And then you will reply to two other classmates about your ideas, and we can kind of come to a consensus about what we would like to do. And I will chime in on the discussion board with you. As you are working to do that, we're going to kind of dive into how viruses spread and how viruses can affect populations, how populations will increase and decrease depending on the amount of resources available, and how close in proximity people are in their immediate surroundings. So let's go ahead and take some time to think about, what could we do to help alleviate that situation with SARS?